Well, hi, kinesiology students. I just want to go through some directional terms with you here right now. And these directional terms are important because they tell us directions in anatomy. So our body can be in different positions. People can be looking at it from different angles. You can imagine somebody in surgery, and one person's at the person's head, another person's at the person's feet. People could be on the side. And if we say things like left or right or top or bottom, that can get confusing really quickly. So we have terms that allow us to say a specific location no matter where they are on the body. First, we start with the anatomical position. Now, you'll have to look up a picture of this later, but the anatomical position is I'm facing you, my feet are forward, my palms are forward, and that is the anatomical position. So that's our starting point, point of reference that we use. But there are terms here that we say in order to help us understand where things are on the body. The first two terms, pair of terms, these are all pairs, are superior and inferior. Superior refers to anything near the head. So anything that's closer to the head is considered superior. And we're really talking about the torso here. The torso, your chest cavity, your head area, excluding the arms and legs. Anything that's near the head, near the top of the head, is superior. So my nose is superior to my chin. My chest would be superior to my belly button. Inferior refers to anything further away from the head. So anything further away from the top of my head is inferior. So my lips would be inferior to my eyes. My intestines would be inferior to my lungs, right? You get the idea. So superior, inferior, torso. The next two pairs of terms are anterior and posterior. Anterior is anything closer to the front. So if I was to give a side profile here, anything closer to the front of my body would be anterior. So I'm looking at you anterior. So these are the muscles that all the guys want to work out. The chest, the biceps, the abs, right? The quads, those are all anterior type muscles. You could say that my sternum right here, my breastbone, is anterior to my vertebra in the back. So that is anterior. Posterior refers to anything closer to the back. So again, side profile, anything closer to the back would be considered posterior. So closer to the back. So my vertebra would be posterior to my breastbone, to my sternum. So posterior muscles would be things like your upper back, your latissimus dorsi, your lower back, your erector spinae, your glutes, your hamstrings, your calves. That would be considered posterior. Next two terms are medial and lateral. Medial refers to anything closer to the midline. Now, the midline is this imaginary line that we use to separate the body into left and right halves. And medial refers to anything that's closer to the midline or closer to that middle imaginary line going through our body. So that would be medial, closer to the midline. So, in anatomical terms, I could say something like my nose is medial to my ears, right? Or my uh, my eyes are medial to my ears, or my sternum is medial to my pectoralis major, to my chest muscle. So medial, anything closer to the midline. Lateral is anything further away from the midline. Okay, so lateral is towards or further away from the midline of the body, right? So my shoulder is lateral to my neck, right? So it's further away from the midline. So that's lateral. Next two terms are proximal and distal. Proximal and distal are really specific to arms and legs. Can't see it. But arms and legs are, your limbs are proximal and distal specific. So when we're talking about the arm, you know, we can't all of a sudden I put my arm above my head and I can't say this is superior and this is inferior because all of a sudden I can do this and then it's reversed. So proximal and distal are specific to limbs. Proximal is anything closer to the attachment point of the limb. So any part that's closer to the attachment point is proximal. So my elbow is proximal to my wrist, right? My wrist is proximal to my fingers. So anything closer to that point of attachment, my knee is proximal to my toes. And then distal is just the opposite. Anything further away from that point of attachment is distal. So my elbow is distal to my shoulder. My knee is distal to my hip. My foot is distal to my knee. So that's distal. So distal further away from the point of attachment. Proximal is closer to the point of attachment. Last two pairs of terms are superficial and deep. Anything that's superficial is like it sounds on the outside, right? So it's like surrounding something. So, for example, muscle is superficial to bone. Um, my rib cage is superficial to my heart. So anything that surrounds something. Deep is just the opposite. It's further in towards the core of your body. So my brain would be deep to my skull. So those are some examples of these directional terms. You're going to find them over and over again in anatomy. When they talk about different structures, you'll see these words pop up. And we also need them to indicate different parts of the body, no matter how our bodies are oriented. So review these, know these, understand these, check the note that is on the website as well. Look up different pictures if you'd like, but have an understanding of these directional terms. Thanks.